Welcome to the October site update. This is Trevor Colhoun, CEO of TPN. This is the main page, the front page of TPN. We'll go log in by using Dr. Patrick Bordnick's site today and profile, who's our chairman of our advisory committee. This is the home page right now behind the gate where you can see connections of clinicians. You can see requests that have been made and information. More importantly, you can go on and see posts that people are making, research, articles that are focused in on the behavioral health space. You can also click to go to the profile page of whomever has put information out. You can also post yourself. So you can post links, you can post photos, you can post articles, you can post videos, linked videos that you would like to share. Let's go look into Dr. Bordnick's profile. He's an active subscriber. It shows here on the right. He's a social worker. He's the Dean of Social Work at Tulane currently in New Orleans. These are his scope of practices. This is his education, his licensure. The main information that you would want to find, you'd find it here about Dr. Bordnick. These are the posts that he's made. Above are the endorsements that he has. This is the video right there that he's done about himself, which actually is a pretty cool video, and I encourage people to look at. To edit his profile page, this is the front part. On the right, you'll see his referral status where he can say, I would like to take referrals, or I don't want to take referrals. He can also put in special numbers if they're different than what he normally shows. Again, he can update his bio here, his website, his phone number. He can add his published works that he'd like. We'll leave this page. We're not going to save it because we're going to leave the information that was there already. You can add, obviously, all your education that you'd like to. You can add your licensure. You can also add to licensure if you have more license than just a social worker or whatever your profession is. This is your scope of practice. We have 5 scopes of practice. We only allow 5 so we don't clog the search engine and our algorithms. We also only allow 10 modalities and interventions of the long list of modalities and interventions you have to pick from. Again, we do not want to clog the search process, and we want people to focus on what they're best at and what they focus on. Same with focused issues. Only 15 are allowed. We have a very robust list. Again, we always want to hear feedback. If there's something you want us to add in terms of a focus issue or a modality, we will do so. Back to the public profile page. Let's go look at Patrick's connections currently. These are all the people that he's connected with on the site. These are pending requests that people sent to him. He's accepted all of them. These are outgoing requests that he's sent to people that he's yet to be connected with. This is the brains of the operation. The Find a Clinician. You can find by name, profession, organization. You can also see by the people that are accepting referrals or people that you're connected with. You can also do it over here as well, a simple process. So when you hit connections, only the people populate that you're connected with, and you can search that way. If you want to hit by referrals, only the people that are accepting referrals pop up. This is the licensures. So we have a robust list of people that we allowed that are licensed onto this site. This is the list here that you can see. You can search by just licensures. You'll see administrators too. Specializations, filter by age. Let's look into specializations here about what you'd pick, but by age, by gender, by focused issues, and by modalities. Much like you saw on the bio, which you fill out, this is how you would be found in your populated. You can also search by insurance. What insurance you take and what you don't take. On your profile page, if you don't see it here being searched, you can add it in as well, like I'm adding in here as well. I can add in a new one to be added in. I am not doing that because there's no such thing as Blue Line, but if someone wants to start that, they can. And they can add it in and be found by Blue Line Insurance. Let's move from here and take out this search and maybe start a new one in terms of specialization. And try to dig in and see how the site performs. So let's look at some of our connections. Let's just pick up on a clinician. Here's Jessica Gibson Kendrick. This is her profile that we can see what she's specializing in, her biography. We're already connected with her. We can endorse her if we'd like. Maybe we think that she's very good at treatment placement, and we can maybe write an endorsement about her and send it on. I want to do that because this is a live site, and we're not going to endorse her, but that's where you would do that, and that's the process for receiving endorsements. Let's look at Felicia Kleinpeter, who's actually our Director of Outreach here at TPN. This is her site. We can also test sending her a referral. This is the referral process. If I have a client maybe that's a male, has alcohol issues, maybe suffers from depression and maybe some trauma, and I want to maybe focus on the modalities and intervention they do, so group therapy. I want to hit the New Orleans office. I also want to give a client code. This code will be associated with your client. We'll build out a portal for that where you'll see how you connect that code and that name on your side of the network, and you can search that way. This is an enhancement coming in this month of October. And then you can write your information. Remember, general information is fine. Names are not good. We all understand HIPAA compliance. We will be building in an encryption portal where you can send documents and paper, but we're not doing that yet. That was sent to Felicia, and she will have that referral. This is BAST. Also, referrals that have been sent to Felicia in the past as we're testing this out and doing this. These are referrals that I have received, and then these are referrals that are closed out, that Trevor Colhoun myself has sent to Dr. Bordnick, and they are closed and they found care. I can also click on the referral that I've sent to Felicia, and I want to share that with my client. So I'll email Felicia's information to my client, and we'll just make up a fake email here, and we will actually send a static web page link to Felicia that my client can view. I can send my client as many referrals as I want to, and in the system, you will be able to track the referrals that you and whom you've sent to. And here's a little message that this clinician will be a fantastic resource. Let's say for you to find a well matched clinician, and that's really what Felicia does well anyway. So it's a great fit. You send this referral out. This referral goes to the clinician. We won't send it out because that's a fake email, but your client will then have a list of live clinicians that are actually taking referrals right now, and they can contact them via email or phone. So thank you all for your time. We're grateful for spending about 8 minutes with us, and we will have more updates in the very near future.